So today I'm going to be using Zorba as my model to demonstrate some soft tissue techniques. So I have palpated over Zorba's epaxial region and found that he's got some pain within the longissimus and iliocostalis, so there's some circulation through the muscle fibres, and he has some tenderness through the thoracolumbar fascia. So grading on the Merrifield-Jones et al. Palpation scale, I would say that Zorba is graded between a 3 and a 4. So the tissue is painful with some responsive pelvic rotation. There's also some trigger points through biceps femoris which are graded more at a 4, so there is a slight avoidance reaction. But I'll just be keeping an eye on Zorba's facial expressions while I give the treatment using the Glera et al.
Equine pain face.
So I have got my hat and boots on to make sure that I'm nice and safe. Zorba is tied up. We weren't able to get a handler due to COVID, but he's pretty chilled out. So I'm just going to use my step. Myself in a good position. Good boy. Good boy. So I've chosen to use some simple effleurage to begin with, just because Zorba's not hugely used to hands-on techniques. He wasn't keen on me standing on the stool. I'm just going to let him settle down a minute. Good boy. Just some gentle work to get him used to having sort of some hands on. It indicates that maybe he's a little bit sore. As you can see, his ears are flickering, his nostrils are a little bit flared. We're just going to be really gentle to begin with. Just working on encouraging blood flow throughout the fascia. So a number of studies highlight how myofascia requires to be changed
From a salt state to a gel state.
In order for the technique to be effective. So you need to conduct sort of around 2 minutes of hands-on techniques before you can start to apply that low-grade stretch, which is known as myofascial release. So as you can see, he's beginning to settle, beginning to have a bit of a lick in the tube. So showing that he's now a little bit more comfortable with me having my hands on him. So I'm just going to begin to palpate a little bit deeper and hold some trigger point release. So you can see through here that there's some circulation of the fibres. So trigger points you should be holding for sort of between 30 seconds and a minute, so that you're releasing those areas of hypersensitivity. There is a study by Django et al. In 2020 which highlighted that if you cause too much ischemia of the tissue, can actually contribute to myofascial trigger point formation, so I don't want to hold it for too long. And the study by Magoo et al. 2019 found that actually any trigger point length between 30 and 90 seconds can be effective in releasing pain. I'm just going to have another go at using the stool now that he's a little bit more relaxed to apply some myofascial release. Good boy. So we use a cross hands technique and apply a low grade sustained stretch through the area. So this technique aims to improve regularity of the myofascial collagen fibres. However, it might be that this technique actually provides more of a neurophysiological response in reducing pain. So Thomas et al. Conducted a study within people and found that cervical and lumbar spine pain can be reduced by the application of myofascial release, but they didn't look at the long-term effects. So there is a lack of evidence really supporting myofascial release, but you can see he's quite happy there. Licking and chewing, there's reduced orbital tension as described by Glera et al. In 2015. So you need to apply this technique for up to 180 seconds. Good boy. boy. As you can see, there's still a little bit of fasciculation on repalpation. However, he's a lot less sensitive, which is obviously what we're aiming for. So I've looked to retreat this again on my next assessment of Zorba, just to make sure that pain response is reduced. Boy. And this is my canine joint mobilisation video. So today I'm going to be demonstrating cervical passive accessory intervertebral movement. So I'm going to be applying a unilateral mobilisation to C3-4 on the transverse process of the joints. So I would use this for dogs who lack range of motion during active and passive assessment, so during baited stretches, or those who have pain or stiffness within the cervical spine, such as those with osteoarthritis. Contraindications to the use of spinal mobilisations would be any dogs with upper motor neurone symptoms, so dogs with ataxia, or those with severe muscle guarding or pain within this region. So obviously I'll be aware of the behaviours going through. Maisie doesn't have any problems with her cervical spine, but she is quite young and can be quite fidgety, so I'll just need to make sure that she's comfortable watching her facial expressions throughout the video. So just checking for symptoms such as licking or yawning or any signs of pain or discomfort. So ideally I'd like to do the mobilisations in lateral recumbency to minimise the effects of muscle activation on mobilisations, but I'm just going to have to see what position I can get her into. I'll give you a treat, come on. Wait, wait, wait. So obviously her muscles are quite active now, but this is going to be the best position to get her into. Wait. So just palpating over the occiput here, coming onto the spinous process, so C3 level, and then coming out onto the transverse process. Good girl. Wait. And I'm just applying dorsoventral. Good girl. Good girl. She's a little bit uncomfortable under, so just take the pressure off a minute. Good girl. So I'm classifying this as a grade 3 mobilisation, so I'm working into a large range of motion, not completely to end range. Good girl, wait. She's looking at the treat. Good girl. So I would use this in a dog that's not acutely painful, so more for range of motion. Grade 1, so a lower range of motion amplitude to treat painful symptoms. So go up. Grade 3. Show you again. So coming down and laterally onto the transverse process, and then just pressing down. So this is potentially ranging into a 4. So good girl. So I can create this into a pavim, so I can bring her around into cervical side flexion. Good girl. Back into the door. Good girl. Alright. So Hausler in 2006 highlighted that the benefits of manual therapy are the reductions in pain, so reduced abnormal behaviours and relaxation of muscle tissue, as well as improving mechanical nociceptive responses. So my outcome measures for this joint mobilisation would be an increased range of motion on reassessing active or passive range of motion, so an increase in cervical side flexion and flexion. But I might also find that within the joint mob there's a little bit less stiffness during the mobilisation, and also reduced
pain if there were pain in a patient.